Hello class and welcome to Chapter 14, Point of Care Collection. Today we will list other terms that have synonyms with point of care. We will identify 4 allergens whose levels can be determined through point of care testing. We will also be describing the most widely used application of point of care testing, and we will also define quality assurance and its requirements in point of care testing. Let's start out with the introduction to point of care testing. As you know, with new and emerging technology, laboratory testing services and results delivered has expanded beyond the laboratory to hospital bedsides, the emergency room, the home, nursing homes, exercise or health clubs, other direct contact patient settings. Terms used for direct laboratory services include, as we know, point of care testing or POCT, decentralized laboratory testing, on-site testing, alternate site testing, near patient testing, patient-focused testing, bedside testing. With the expansion of point of care testing being in high demand due to the fact that it's faster than a regular laboratory test. You can get results within minutes versus within hours. A new focus group has come into play as far as to harmonize POCT testing. They are called the International Organization for Standardization, or ISO 22870. And basically, they have special regulations for point of care testing that lies under them, which also lies under the Clinical Laboratory Improvement Amendment of 1988, or CLIA 1988. As we know, most POCT testing is a wave test, meaning if you get proper training for conducting POCT testing, you as a phlebotomist can also do these types of testing. And usually we do those if we're working as an outpatient or working in a doctor's office. Normally, if we're in a hospital setting, we won't even touch a POCT test. We strictly do venipunctures. And usually, sometimes when a nurse does take a POCT test, they'll also, if the numbers are abnormal or they're high, they'll call a phlebotomist in to do a venipuncture draw just to compare to make sure that the machine is working properly and that they have the accurate result from the POCT test. Point of care testing they use small amount of blood versus when you do a venipuncture. It's mostly due to skin puncture. Sometimes it's done through urine, sometimes it's done through saliva. It just depends on what type of POCT test it is. These are different types of POCT testing. You can do a urine dipstick. Of course, the one we're familiar with is the one we use in lab, is the blood glucose analyzer or meter, blood gas and electrolyte analyzer, hemoglobin A1C, anti-coagulation testing, infectious disease testing such as for influenza, and of course the new one that we have now is for the COVID-19. That's another POCT test that they have now. Frequently used POC test is the BNP, the blood creatinine, the EGFR, electrolyte and blood gas analysis, and of course, glucose. Those are the most frequently used POCT testing instruments that we use or test. Along with that, we can also check Hemoglobin A1C, we can just check hemoglobins. We can check for infectious disease such as HIV, influenza A and B, for lactic. We can also test by point of care testing lipids such as cholesterol, HDL, LDL, triglycerides. Pregnancy, of course, is a point of care testing. White blood cells can also be done by point of care testing. The first point of care testing meter we will talk about is, of course, our favorite one, the glucose meter. The glucose meter checks for diabetes, patients who have diabetes. Basically, it's a chronic disease within the pancreas due to the fact that it cannot produce enough insulin and cannot use the insulin that it does produce because it's not enough. Insulin causes the glucose to be absorbed from the blood into the body tissue and therefore uses the energy that is produced from the glucose. If your body does not produce enough insulin, it can't produce glucose. And sometimes, if you ever notice when somebody's blood sugar is high, they get sleepy, they have loss of energy, they just feel sluggish. It also goes into play for people who have hypoglycemia or low blood sugar. They experience the same type of reaction. They start to feel lethargic, sleepy, loss of energy. Even if you're not really diagnosed with hypoglycemia, even a normal, everyday healthy person can experience low blood sugar times. So next time when you think you just haven't had enough sleep, and if you definitely know you had enough sleep, and then all of a sudden you just get really sleepy and really tired, it's because your body is trying to produce glucose and there's not enough insulin in your body to produce it. Therefore, your blood sugar has dropped. Another telltale sign is you start to get the shakes, you start to get lucid. That's from low blood sugar as well as high blood sugar as well. So with diabetes, it's just the lack of insulin in patients, which can increase blood glucose levels due to they don't have that stimulator or that equalizer called insulin. So they produce too much glucose or sometimes too low glucose. Glucose analyzers and meters, they are small in diameter. They are more commonplace in homes, nursing homes, hospital bedsides. The thing about these meters is being that it goes from patient to patient who is diagnosed with diabetes, they have to check to make sure that their sugar levels are normal. You have the high risk of acquiring infectious disease, so therefore you have to use your safety protocols when using instrument that is communicable, meaning it goes from place to place to place. Normally, if a patient is an infectious patient, they usually have an extra meter to where they'll put that 1 meter in that patient's room, and that meter is strictly used for that patient only, for no other patient but them. So if you take a look at table 4.1 in your textbook, it talks about the blood glucose monitors, the different ones that manufacturers make. You have the AccuCheck Aviar or Roth Diagnostic Core. You have the Contour Next 1 meter system. You have the One Touch Vilo, and you have the Freestyle. Some of these you probably heard of or you probably seen just walking down Walmart in the pharmacy aisle. You probably seen some of these POCT glucose monitoring systems. The one that is shown right here in figure 4.1 is the blood glucose monitor. That's the most common one we see. It's a little different from the one that we have, but it's the most common one you see. Now this one in figure 4.2, this one is called the Hemocure Glucose 201 Analyzer. It's a little more high tech, and instead of using test strips, it used microcovents to collect a blood sample. So in figure 4.3, it explains how to collect or obtain blood using a microcovent for the Hemocure Glucose 201, 201 plus, or 201 DM. In figure 14.4, this is a stat strip glucose analyzer. It still uses a test strip, but as you can see, it's very digitalized, and it has the patient's name, and it also has a place to where you can type in a comment, and it automatically uploads to the patient's medical records. When obtaining a blood specimen for a glucose test, it's usually a skin puncture or finger stick. As we know, we have to gather our equipment, make sure safety is first, that we have a safety automatic lancet, which is a lancet that retracts the needle as soon as you just push the button. It retracts back into the safety device, so you can have less risk of a needle stick. As always, we have to identify patients properly. We have to briefly explain what we're doing and what type of test we're doing to the patient only. If there is a guest in the patient's room, that's kind of like a gray area, because like I said, HIPAA, we're not supposed to disclose any information that is concerning the patient when there's other people in the room. Make sure you clean your hands. Of course, that's hand hygiene. That's less risk of transmitting infection from one patient to another. Like I said, if you can't get to a sink with soap and water, make sure you always have hand sanitizer. And of course, put on gloves, because you are dealing with direct blood specimen. It's not being in a safety evacuated tube. It's an open air blood sample. Make sure you select your site and clean with antiseptic, especially the sides of the finger. Remember how I told you how to wipe off a patient's finger? And if you have to do it more than once, do it more than once. Always make sure once you clean the skin with an alcohol wipe that you allow the skin to dry properly, and I mean fully dry. If for some reason you depressed the lancet and the alcohol wasn't fully completely dry, you'll have an inaccurate reading. Sometimes the meter, if it's a smart meter, it'll give you an error message, only because you're mixing blood with alcohol, so it's not being able to read your glucose level. So you have to make sure that the skin is completely dry. Another telltale sign of knowing that you have a completely dry finger is when you get your blood, it'll form a nice little bead and not spread out. So if you got a nice little pretty little bead, you did it correctly. If it's starting to spread out and smear, then that means the alcohol wasn't fully completely dried off the patient's finger. So step one, clean the finger. Gently massage the finger a few minutes from base to tip to aid blood flow. This is another way for you to also check your patient's temperature. If a patient's hands are cold, you're not going to get a good sample, because why? If a patient, that's a telltale sign of poor circulation. So if your patient's hands are cold, you can either one or two things: warm their hand up by placing your hand on either side of their hand and rub that way, or you can get a warm towel and wrap the patient's hand in a warm towel. Or if you're not sure if they have a clean towel, you can take the patient's blanket because you're going to have to disinfect the fingers, the stick site anyway. You can take the patient's blanket and kind of rub their hands in between the blankets to warm up their hands. So once you have acquired that, then you gently massage that the site finger that you're going to use to make sure that the blood flow is adequate. So you're going from base to tip and you're just gently massaging. And basically what you're doing after a while, you'll see that fingertips start to turn red. That means you got a good flow going towards that finger. Decide on which side of the finger you want to make the incision, either the left side or the right side of the finger. Remove the safety lancet from the protective paper. Hold the patient's finger firmly in one hand and make a swift, deep puncture with the retractable safety puncture device. So that's figure 1433. So to press the lancet, hear a little click. That means that needle has retracted back in and you have your incision. As always, with the Hemocure blood sample collection, we have to wipe the first 3 drops away with a clean gauze. But with a regular glucose strip monitoring test, we only have to wipe the first one off. So with a Hemocure glucose monitor, is the first 3 we have to wipe away, and then we collect the 4th. Gently massage the finger from base to tip to obtain the needed drops of blood that is needed to fill the test strip or to fill the microcurrent, as with the Hemocure is what is needed. Never ever squeeze the fingertip. Why? Because that's when you're going to get diluted sample and you're going to get tissue and fluids, interstellar fluids, and then you're not going to get an accurate test. Apply the Hemocure microcurrent to the drop of blood. The correct volume is drawn into the current by capillary action, meaning it pretty much kind of sucks in on its own due to the way it's designed. So there's a picture of it. Wipe off any excess blood from the side of the current, such as this, because we don't want, because it goes into the machine. So we don't want to contaminate the machine with excess blood that's hanging out, because it's kind of hard to clean inside the machine. So we have to make sure that the device that goes into the machine is wiped off properly. Place the microcurrent into the current holder and insert it into the photometer, such as this. The laboratory test result is displayed automatically once it has analyzed it. So once it's inserted, it will pop up the results. We will discard anything that doesn't need to discard everything that we used on the patient in its appropriate spot, meaning the lancet goes in the sharps, the gauze, the alcohol wipe, the gloves go in a biohazard container, and of course wash and sterilize your hands. That's it. Glucose meters or analyzers, you always have to carefully read package insert and user manual because, like I said, for the Hemocure glucose monitor, as you can see, as we just displayed, you have to wipe off the first 3 drops. But with a regular glucose strip, you only have to wipe off the first 1. So we have to know how to use each different type of POCT instrumentation to see how many, especially if it's a skin puncture, to see if we need the first drop, the second drop, third drop, fourth drop, which one do we need in order to get an accurate reading. So make sure you carefully read the package insert and user manual to each new POCT testing monitor. Always watch an experienced healthcare professional perform the test, especially if you've never done it before. Strictly follow daily quality control procedures, meaning every time you change the battery, um, make sure you do a quality control test on it to make sure that it's reading appropriately. Every time you clean it, you have to do another test on it, and carefully record the results after you have completed the testing. Glycated hemoglobin, or HbA1c, is a reliable measure for glycemic control. At HbA1c, POCT analyzers will use drop of blood about 4 to 10 um, unit liters, taken from a finger stick, or sometimes we can do venous blood sample as well, which is applied to a reagent cartridge and inserted into a desktop instrument for analysis. Values monitored with quality control material is very important. Electric quality control, or EQC, to test electronics, meaning some of the POCT testing, they're not really, I know it says bedside, but sometimes we have to collect it from the patient and walk it to an instrument because it's not a handheld instrument. It's kind of a bulky instrument, but it's still considered a point of care testing because it gives you a result right then and there. You don't have to walk it all the way down to the lab to get the results. So some of these bigger machines have its own quality control testing on it on its own. You just have to hit a button and it'll do a quality control on its own. Quality material analyzed, so means and standards deviation can be calculated. This is to make sure that when you are testing, that the results you are obtaining are reliable and accurate, and it also keeps the instrumentation up to par. When you are doing quality control testing, always make sure that you document. What I've always said, you have to document everything that you pretty much do in the hospital, especially when it comes to quality control of a POCT analyzer. You have to document what time, what day, which POCT you tested, and what was the results of it, and was it accurate, and did you have to recalibrate it? You have to document all those things whenever you're testing. And usually by each one of these machines, there is a log to where you have to log in all this information and keep a chart of what's going on with the machine. Quality and point of care testing and disinfecting POCT analyzers. Reproducibility of the results. When purchasing reagent strips and controls and quantities to enable healthcare workers to use constant pools of the same lot number, sometimes we do, like, especially if we're doing a quality control check, we'll pull one test strip from one batch and then we'll pull another test strip from another batch to make sure that we get the same accurate, same results or close to the same results as if we got with the last lot. Because if there is any discrimination, we can throw that lot away and use the newer one. Now, just like anything in the medical field, everything has expiration date. So if your first lot fails and your second lot is accurate, make sure you check the expiration date on that first lot to make sure it hasn't expired. Always use preventative maintenance on your POC testing because it is critical for accurate results. Right. This particular instrument here is let me find it in the book, I'm sorry. This particular instrument in figure 14.6, this is the NOVA Biomedical Stat Profile Prime Critical Care System Series. So basically with this instrument does blood gas analysis. It does like a patient-focused testing. It not only tests the patient's blood gas analysis, but it also tests the patient's pH level in their blood, which is very critical, especially if someone has a heart or lung disease. So it checks the PO2 and the PCO2 as well as the pH in a person's blood. So whenever they're checking for blood pH, remember they're checking to make sure that the blood is not too acidic or too alkaline. Because remember, your body has to be in constant homeostasis. It has to be one with itself. It has to be a steady, well-tuned machine. So we have to always make sure when a person comes in and their blood gases are abnormal, we have to also go along hand in hand is to check the pH levels. With new technology and the advancement of the medical field, there are a lot of POC instruments that can do multiple things that we do as a venipuncture as well. Now, not only can they have check glucose or blood gases or pH levels, we can also check electrolyte levels such as sodium, potassium, chloride, and calcium. Of course, we can check glucose, but we can also check for lactic. We can check for hemoglobins. These are all critical things that have to be associated with critical care situations. Because like I said, if your body is shutting down or your body is not reacting to something or your body is saying, I don't feel good, there's something wrong. Electrolytes, glucose, lactic, hemoglobins, blood gas, pH, all of that is considered a critical care situation. This is stuff that can be done within minutes versus within hours, especially if it's a critical situation. Now, don't get me wrong, we're still going to have to draw the patient through a venipuncture, but this gets the doctor started on what's going on so they can stabilize the patient. Acute heart damage. As you know, when somebody suffers from an MI and they're in the emergency room, we get called, or if you happen to be a ED tech, you get called into the patient's room, you draw venipuncture. They'll tell you to draw cardiac enzymes. Remember, your cardiac enzymes are your troponin, your CKMB, and your CPK. That's the triple threat, or triples for heart analysis to see if a patient has gone through a stroke or MI. Point of care testing for acute heart damage, if they want to know right away, is they'll use a machine called the Roth-T, which is a simple, sensitive, rapid assay, which will measure the troponin T to detect if there's any heart damage done, which is the same thing as the troponin, just without a venipuncture. It's just a faster way to check. Another point of care testing instrument that is now being circulated or now being used is your WPC system. This one also happens to be a Hemocure, but this one is called a Hemocure WBC system, which tests to see if your white blood cell count, to check your white blood cell count. Because remember, if your white blood cell count is elevated, that means it's fighting some type of infection. Or you might be pregnant. Congratulations for women, that is. Um, But this is another critical care thing because, like I said, WBCs are if they're elevated, sometimes signify your body is fighting some type of infection. So they do have a rapid test to see if your WBCs are elevated. And basically, with this analyzer, it uses 10 ULs of whole blood from a finger stick, or sometimes we can use it from a venous if we just happen to draw a venipuncture and we have an EDTA sample or a purple top. The nurses can take a drop out of our purple top and run this rapid test on the patient while they're waiting for the official lab report. Blood coagulation monitoring. As you know, this is to check to see how thick or thin your blood is, how fast your blood can coagulate, can form a clot. Immediate results used in controlling bleeding or clotting disorders in patients, especially those who are hemophiliacs or those who are on blood thinners, because too much of a good thing, especially on a blood thinner side, is a bad thing, meaning if they just bump themselves, they bruise. That means their blood is too thin. So there are different meters to check a rapid response versus us doing a venipuncture, which, like I said, takes hours versus minutes. So these are the different systems that some hospitals may have. You have the Coag Check XS system, the ITC ProTime microcoagulation system, the ACTLOC Active Clotting Time Test, or ACT, the ALAR IN ratio 2 meter. The first one you see, which is on figure 14.7, this one is the Coag XS Plus system. As you see, it kind of looks like a big form of the glucose meter. It has a test strip and they collect a blood sample from a finger stick. This one, well, it says it is the ACT. That's the ACT system. And then this one is the Allure IN ratio 2 meter. These are all the meters that check for PT-INR, or to see how thick or thin your blood is. Another type of test that has come along is also that can check your hematocrit, hemoglobin, and other hematology parameters. As we know, hemocrits, or HCTs, are packed cell volumes, which represents the volume of circulating blood that is occupied by red blood cells. It is expressed as a percentage. Thus, the hematocrit value of 38% indicates that there are 38 milliliters of each 100 millimeters of peripheral blood is composed of red blood cells. This is another way also to check to see if a patient is anemic. So to collect a hematocrit, it's simply a skin puncture or finger stick, and it uses a plastic microcapillary tube, which are used to collect the blood sample. To check for hemoglobins, which are more accurate than hemocrits and is a lot safer to detect anemia in patients, they'll check the patient's hemoglobins. This particular instrument is called the HemoCure HB201 Plus Analyzer. This is used to check your hemoglobins, which is more accurate to diagnose if a patient is anemic or not. Cholesterol testing. As we know, cholesterol tests are semi-quantitative estimates of total cholesterol that in 3 minutes can use just one single drop to determine if a patient's cholesterol levels are within range. And the test that is used is called a ChemCar cholesterol test. It simply uses a finger stick, to test for total cholesterol values. It can also test for HDL, LDL, triglycerides in a person's blood system within 5 minutes. It can use only 40 microliters of whole blood, and the instrument that they use to check your glucose levels or your total glucose levels is called the Lower Cholesterol Tech LDX system. Future testing, or tests that are existing now that are very, very new, is called the Billy Check. This is a point of care testing that now, instead of getting the baby's blood drawn, nurses can do a Billy Check to check the newborn's bilirubins to make sure that they're within normal range. And if they're not, to put them under the special UV light so they can get their bilirubins up. This measurement is usually conducted in the neonatal skin. No blood is really collected for it. For this particular test. And of course, now we have HIV test on a USB stick. It just takes one drop of blood to detect HIV. I know a while back they used to advertise it on TV about this rapid HIV test that you can do at home now. Basically, it creates an electrical signal read by a computer, laptop, or a handheld device, and it's a disposable test that is acquired. I know they're still out there because it is a fairly new POCT testing. The Novo Biomedical Stat Sensor point of care creatinine and EGFR handheld EGFR analyzer, which is available for whole blood creatinine testing. There again, it can test within minutes versus us drawing for creatinine levels. Healthcare workers, when using POCT testing, must know how to collect blood for the required instrument. So they have to make sure that the blood collection requirement is adequate to the machine that they're using. They must always remember to have preventative maintenance due to the fact that we don't want to transfer any infections from one patient to another. Make sure you give good quality control, meaning always test your instruments to make sure they're up to par, especially when you change out your battery or you clean it, or you just might think it just not running. You're getting too many error messages. Quality control. Infection control requirements. Always remember your infection control requirements. Ethical and legal implication. Just because it's a POCT test, we still have to follow HIPAA law. We still have to identify our patients. We still have to make sure we're kind, courteous, and within the scopes of our profession. If the patient refuses to do a POCT test, just like if they refuse to do a venipuncture test, we have to abide by those rules. Record keeping. Make sure when we are doing quality control as well as patient documentation of refusal, we do proper record keeping of said test that the patient has either refused or we did quality control over. We have to document. Calibration requirements, always remember after And make sure you read your manual and your manuscript on how to properly use this instrument, because they will tell you after so many patients, make sure you run a calibration test. And that is very important in order for the machine to always run effectively and to give you adequate results each time you use it. And this concludes Chapter 14's lecture. If you have any questions or comments, you can either message me or text me. I hope this helps you a lot in studying for your upcoming test. I do thank you and have a nice day. Bye-bye.